Okay, we've given people a minute or so, 5 minutes extra to join. Let's start the presentation. Well, hello, and welcome to HIPAA Protections, Security Risk Analysis, specifically focusing on a risk factor that is becoming very predominant, which is social media. So welcome to HIPAA Protections, Security Risk Analysis, and we are going to focus specifically on social media. Now, before that, want to just go through a couple of slides to illustrate a very important point when it comes to compliance. So these workmen are installing cast iron bollards to stop nurses from parking on the pavement outside the Royal Hospital in Belfast. Notice anything that could get these guys in trouble? Well, they are cleaning up at the end of the day, but will not be getting off, going home anytime soon because they've kind of barricaded themselves into the parking lot. So why do I show this? Well, there are so many things that we do, so many simple tasks that can have very dire consequences. And I think that will be a big message within this presentation, but we're going to talk about a lot of safeguards and protections so you don't have the kind of pain these gentlemen experienced. So who am I? My name is Lance King. I'm the Vice President of Sales at Healthcare Compliance Solutions. And many of you have been personally invited by me or have been invited by somebody from your practice, or perhaps you're joining for the first time just because you saw something on LinkedIn. Well, I just wanted to let you know just a little bit of background on what motivates me to be a part of a compliance company. I'm a big fitness guy, and oftentimes people say, well, what are you doing in compliance? That just seems so abstract. I agree that in many ways it is, but once I learned about how compliance really is about protecting our patients, you go to such lengths to protect them and to ensure their health care, but so often there are just the smallest things related to OSHA or related to HIPAA compliance that can really tarnish a reputation and, most importantly, cause a lot of unnecessary illness and injury. This is my daughter, Malia. Many of you may know that she was hospitalized for having RSV, but over a period of a day or so, contracted pneumonia, which we believe was due to a lack of protective equipment in the hospital setting. Now, this hospital did everything they could to help our daughter, but because my wife is just very observant and actually she was a little panicked because of her experience working as a surgical nurse and knowing how forgetful people can be, she was watching and actually encouraged on several occasions the staff members to make sure they were being safe, because there were patients with a lot of things in the ICU, and we didn't want to get them. In particular, pneumonia. She did end up contracting that, and so I'm an advocate for making sure that patients are being protected. We've also had a situation where our information was stolen. Have you ever been involved or known anybody that's had any identity theft? Well, this happened to us, and you may have heard that identity theft cases, they can take an average of 300 hours for people to recover from, and I would say more than that. In fact, we talk about that every so often, just on how big of a nightmare that was. And unfortunately, my sister-in-law recently started going through a process of recovering her information because her information was stolen. And so, HIPAA and OSHA are very close to me, and that's a big part of why I'm here. Well, here's what to expect. Here are some things that on the onset, at the outset of this presentation that I'd like to make sure we review. I want to go through just the why behind the need to increase self-audits. And I think that's probably why you're here, is to just get a quick self-examination of things and also to understand where social media is going and how to be protected with some specific safeguards. Quick review always helps with the HIPAA security protocol. So we'll review that, as well as how to conduct a risk assessment and some HIPAA security recommendations. I think you'll find after just this part that if you haven't conducted a risk assessment for HIPAA security, I really think you're going to have the tools that you need to then go out and get a 360-degree view on some of the strengths, weaknesses, opportunities, and the real threats for your practice. And unfortunately, some of those threats you'll find are your own staff. The staff tend to be the biggest liability, unfortunately, which is why we're going to go through the role of social media in healthcare, how it is increasing, how it's actually improving the reputation of practices, bringing in more patients. Talk as well about some of the social media safeguards. You want to be protected with the changes that are taking place, and we'll go through some cases that involve breach of HIPAA privacy in a very big way. I think you'll be really surprised that people went to the lengths that they did. And we'll go through some compliance solutions, things that can take place in-house. Also review some of the alternatives to that. And certainly I want to make sure you guys are aware, you guys and gals are aware of our compliance solution. Well, part of this presentation was designed with you in mind, being aware that we only have 168 hours in a week, and we get that patient cup is full. The staff are just so important. They have so many demands. There's so much going on with front desk. You have accounting that's constantly there, and you want to have some fun. But the challenge with with how we allocate what we can offer is that often compliance is neglected. And many of you are watching this. It's my guess, because my guess is you're watching this because you have neglected compliance. And so we are grateful that you're here. Well, audits are increasing, and it is a result of the increased number of breaches throughout the United States. Well, because there's been an increase of apps, increase of online resources, platforms for patients to access their healthcare records, communicate through the cloud, through these patient portals, and because mobile devices are being used to improve communication throughout the offices and with patients. So there's just a much greater need to incorporate a culture of compliance with privacy and security. And that's a big mission for us, is to help you integrate a culture of compliance with the attitudes and behaviors in the office. And hopefully this presentation will help you to influence those so that you can make decisions over time to create that culture of compliance. Well, I think it's notable that we do put some of the violations, if you ever do experience a HIPAA audit, just know that if you act on the things that we talk about today, it should put you in a much better category. A lot of people are in willful neglect, and they're not interested in preventative and corrective measures to do anything about the privacy and security safeguards. And I think that's unfortunate. especially because of how many families are impacted, and especially because healthcare providers watching this, will you not see a provider yourself this year for something, a dentist, to get a physical, something? And wouldn't you want to make sure your patient information is being handled correctly, as well as the necessary OSHA safeguards in place? So, just some things to look at. Again, penalty per violation, there's really add up. It is very common to see fines and settlements to total well over $1 million. And if you've been following me on LinkedIn, you can see a lot of case examples where that's happened. So the protocol around HIPAA security, it covers requirements for administrative, physical, and technical safeguards. So keep that in mind. I also want to let you know that if you need a risk assessment that can help you out, I'm happy to provide one for you, and I'll post my email address at the end of this. 7 quick steps to HIPAA compliance. The first, well, you gotta understand the rules, just like in any sport or any activity, any game that we play. We must understand the rules, which in this case is reviewing the regulations and learning about HIPAA. Second is assigning a responsibility. Appoint somebody in the office that can be the compliance officer. We suggest that the compliance officer is not the doctor and not the administrator, if you can possibly manage that. Third is list your PHI systems. Okay, identify your information systems and the things that are utilizing and transferring patient information to business associates and throughout the office. Fourth is conduct a risk analysis, assessing your vulnerabilities, prioritizing your risks, identifying security measures to be implemented. And then 5 is to implement your policies and your procedures. Now, while you do this really is where the culture comes to this. Implementing a policy, it's not something that just happens overnight. Certainly you can communicate that and receive feedback, but this is something that throughout the year should be measured, and things should be documented. So figure out a documentation method that works best for you, so that you can address any security policies and controls to match those policies. And we're happy to provide some advice for you. Deliver a compliance training program. And so this is suggesting that employees should be aware of the rules, especially as it pertains to their role in handling protected health information. And when you train, remember to document the training. And this training should be an initial and an ongoing training. Okay, auditors want to see a paper trail of ongoing training. So monitor and document the ongoing HIPAA progress and compliance. And this again is suggesting that you perform self-assessments, you monitor, you test privacy and security programs, and also integrate privacy complaints and any security incidents. So with your security risk analysis, a couple of things that I want to review. We've briefly mentioned that one of the most important things in your PHI, in your security risk analysis, is to identify where PHI exists and how it's created, how it's received, how it's maintained, how it's transmitted, and including how things are done with your electronic health record system. Types of risks to the ePHI, electronic patient health care records, information, So types of ePHI maintaining your EHR, just to note, it does vary depending on whether your EHR is based in your office or hosted online. I know there are a bunch of different resources out there. You want to identify potential threats and vulnerabilities to PHI, and that includes human threats such as a cyber attack, theft, or a workforce member's error, and natural threats such as earthquake, fire, tornado, and environmental threats. So you've got human threats, natural threats, and environmental. And environmental is an example of that is pollution or power loss. And so assess these vulnerabilities, which are flaws or weaknesses that, if exploited by a threat, certainly can result in a security incident or a violation of your policies and your procedures. So the next step is identify risks and then their associated levels of high, medium, or low. So this is done by assessing the likelihood that the threats will exploit vulnerabilities under the safeguards currently in place, and also by assessing the potential impacts to confidentiality, integrity, and availability of the protected health information. Okay, so the game plan, start with having your HIPAA compliance officer assess potential shortcomings in how your practice protects your information. Discuss findings and solutions with your EHR developer. Certainly, they're going to only help you in understanding how that EHR system is going to be integrated and ensure the protection of that. And then, of course, keep documented results of your analysis in your compliance binder. And hopefully you have a compliance binder, because that binder is going to continue to grow throughout time. Also, risk analysis can produce results that you may find result or fall into gray areas. However, you will be able to see where you are meeting, not meeting, or exceeding HIPAA requirements at a given point of time. So take advantage of the flexibility that the HIPAA security rule provides, which allows you to achieve compliance while also taking into account that you are an independent practice or an independent organization that has unique characteristics of your organization and its environment. So it's important your security plan is feasible and affordable for your practice, but also just know that compliance sometimes can be a little agile given the unique sets of circumstances. So again, your last reminder that your binder, over time, it will become a tool that will help with your security, and that your security protocols will continue to evolve over time. So just some tips for better security risk analysis. We think it's important to educate your staff about the iterative and ongoing nature of a security risk analysis process. And I've mentioned that, but I just want to again reiterate that. And and oftentimes we'll talk to staff members that really don't understand this process. Make security a high priority in your culture. Again, this is part of that ongoing process. Have an action plan that clearly assigns the responsibility for each risk analysis component. Involve your HR developer in the process. And lastly, just ensure that the risk analysis, again, it's specific to your unique practice. And so what I'm suggesting there is that this is something that's customized. It's not something you can just buy from a company and have everything developed for you. So some takeaways that I think you should take notes on. These are 10 tips that will save small practices, especially, boy, time, money, and certainly reputation. So, yeah, just keep in mind small practices. You face the same types of risks as bigger practices, but the problem is that oftentimes you lack staffing and lack the resources to respond to the same risk factors as a large organization. So hopefully you'll take some of these notes. And so here were the top 10 that we'd recommend, and I'll just move quickly through these. If you have any questions, feel free to comment below. So have a written security policy. Encrypt everything. Protect your website. Make sure you're backing up data. Avoid consumer grade. Know your risks. Plan. Know who's guarding the sheep or the patients. Physical security is information security, and know when to call for help. Okay, and we have an article that goes through much more detail of one of our from one of our strategic partners. It helps a lot of practices, and we're happy to provide recommendations as well if you'd like to understand a little bit more. Well, the last thing that I'm going to say about security risk is the precautions. So just some low-cost, highly effective safeguards for you is first, just to say no to staff requests to take home things like laptops or other portable devices containing unencrypted EPHI. And remember, this is, you may consider talking to some of your business associates to find out what they're doing. They should certainly, business associate like an anesthesiologist should certainly be adhering to HIPAA, and they should sign a business associate contract that states that. And we've had cases, several of them, where we receive a call and someone's information has been stolen in a car or their house is broken into. Okay, so say no to staff requests and make sure you figure out what your business associates are doing. Remove your hard drives from old computers before you get rid of them. Do not email electronic patient health information unless you know the data is encrypted. And make sure your server is in a room accessible only to authorized staff, and make sure you keep the door locked. And I don't know if you were here for one of my other webinars, but my brother-in-law, who is a physical therapist, said that a couple months ago, a guy came in claiming to be an IT guy that needed to see their server. And he had signatures of individuals that supposedly had been given them access. And a front desk attendant was a little suspicious that he would need all these signatures and things. And when they double checked them, it turned out he was he was there to do something that he shouldn't. So yeah, make sure your server is in a room that is only accessed by people that should be getting in there. Make sure that the entire office understands that passwords should not be shared and they shouldn't be easy to guess. Make sure the password's long. You don't have to have a password of a bunch of characters that, or asterisks and signs and all these things, smiley faces. But, if your password was something longer, then it's most likely going to be much more difficult for someone to look at. Unfortunately, your staff are your highest liability in most cases, and so just notify your staff in advance that you are required to monitor their access randomly, and it's good that you do mention that in their training right when they come on, if you can, so that it doesn't so you don't breach the relationship of trust that you have with them. And then fire extinguishers should definitely be maintained. And also just check your HR server often for viruses and malware. Super important that you do those things. So hopefully you've taken some notes. And I'm going to now transition into one of the risk factors that is being talked about a lot more, but a lot of people, they're not really sure why to use social media, and if they do use it, how do they do it in a way that is appropriate, and can you use can you talk about patients, and so I'm going to try to effectively answer some of these questions, and I hope that you'll ask some questions to us so that we can provide a little bit of guidance for you. So reasons to use social media. So we use social media a lot, actually, and so we're going to say that one of the reasons is to develop yourself as a community authority. And in this case of social media like Facebook, for instance, Facebook allows you to engage with your community. When people ask questions, you're able to provide some answers and help people feel comfortable with who you are. Now, as far as an authority is concerned, you can post articles, you can share insights and opinions on various things. You can talk about some trends. You could even, again, go back to the community thing, you may even do things like contests to try to bring people together. So you're a community authority already. Why not scale that with the use of social media? Another reason is transparency. Boy, people feel much more comfortable going to a place where they kind of feel like they understand the culture already. So reasons to use social media, well, give people kind of an inside view on what it's like in your practice. And you can do that by, just posting someone's birthday, posting something somebody's done recently that's exciting. Just, doing things that show you're human and not just this mechanical practice, right? That's just a bunch of systems and procedures and everything that's not fun about going to the doctor's office. So another thing is patient information. Okay, as patients, we're curious. We don't know what kind of things are out there, what kind of issues are out there. Let us in on some of the things to look at. It's always great to do question and answers. Okay. Facebook Live is a big thing right now. Live video is big. Give people a chance to communicate with the doctors and healthcare providers. You may consider some short videos on explaining some of the procedures. Just anything you can help people become more educated and aware and more comfortable is going to help you build trust within the community. Also, patient satisfaction. Okay, you can survey patients. There's also review sections. I know with Facebook there is an area for review and for stars, which certainly helps in a day and an age where so much is done online before anybody makes a decision to go in anywhere. Marketing services. You may market your procedures. You may show that how you're service oriented by things that you do in the community. Maybe some community events. You may do discounts. Okay, so it's great for that. And then lastly, I'll just say it's, you can actually call somebody. You can go to someone's Facebook page and then call the practice. And so it's a great way to set up appointments. Okay, so a lot you can do to retain the patients that you work so hard to serve and effectively become a leader and an influencer within social media. Well, just get an idea of of the growth and the reach of social media. Going back to a goal years ago across varying platforms to create awareness, the goal being to reach 50 million users. So with radio, it took 38 years for that to happen. With television, it took 13 years, and actually that dash should be a colon, so it doesn't look like TV 13 or TV 14 like a rating or something. The internet took 4 years, and boy, Facebook, to get 50 million users, Facebook took less than 6 months. Okay, so social media is very well used and very actively. There are a lot of very active users, and boy, social media sites have really increased throughout the years. Here's a chart by the Pew Research Center. When they began tracking social media adoption in 2005, just 5% of adults used at least one social platform. But as you can see, there's been a huge trend where it's really spiked. In fact, by 2011, there had been about half of all Americans that were using social sites, and today about 69% of the public uses some sort of a social site. Another chart I wanted to show you. So who uses social media? Well, as more Americans have adopted social media, the social media user base has grown more representative of the broader population, which a lot of people may think, well, 65 and up, they're not on social media. But usage, as indicated, usage by older adults has increased significantly. So how often, you may say? Well, for many users, social media really is part of their daily routine. In fact, most of you that are seeing this probably saw an invite on LinkedIn. So roughly 3/4 of Facebook users and around half of Instagram users visit these sites at least once a day. Okay. Now, what about the percentage of consumers using health information through social media? Well, here is, again, from this research institute, 42% of health-related consumer reviews is being done. Friends and family health experiences, 30% is being viewed and commented on and engaged. 29% other patients' experiences with their disease, and health-related videos posted by patients, 24%. And I'll tell you, I see family members all the time posting injuries and posting experiences of recovery. And so, as far as using social media and worrying about there being enough engagement, well, business strategies that include social media really can help health industry companies to take more of an active, engaged role in managing individuals' health, and you can see that again by these services. And the idea is that social marketing can evolve where, with the right leadership and investment of resources, you can provide a tremendous value to your community, and over time, increase the trust that people have. And the more they trust you, the more likely they are to go and also to recommend your friends. And so as you use social media, we're confident that you'll find that you'll better be able to meet the needs of today's patients by tuning in and also helping people to tune into some of the things that are taking place. Last kind of awareness that I'm going to put out there: 6,599 hospital social networking sites are out there. So if you're looking to just segment, getting into a networking site to talk with colleagues, get recommendations, etc., I mean, there's 6,500 out there, and out of about 1,600 hospitals in total, it's been discovered that 720 are using YouTube channels, 1,300 Facebook pages, about 1,000 Twitter, and 657 LinkedIn, with about 215 blogs. Okay, so that's so as far as, am I going to be the first person pioneering this? Well, if you're not already investing in this, this is kind of where things are going. And so that's why we want to talk about real quick some of the things that you don't want to do if you determine that this is how you want to scale. Okay, just four quick things. Do not discuss patient information when you do get online, or if you are. Do not post pictures of patients without permission. Do not friend your patients if you're using Facebook type of a platform. Okay, people can find you and like you, but don't, if you have a Facebook page and you saw that someone likes you, don't connect with them then personally. Oh, I'm going to connect with Mary because she liked this. Don't do that. And do not focus on self-promotion or promoting the practice. Okay, this is about your community. This is about your patients. It's not about self-promotion. Well, I want to talk about a HIPAA violation and then get into a couple of other violations. I think this is a very instructive thing, so you can learn a little bit more of the violations through some of the stories. All right, so the first one, so there was an employee that had accessed the medical records of a patient and then afterwards took a screenshot of her medical records and uploaded them to their Facebook account. Okay, can you even believe that? Yeah, just not a good idea. So from there, that same image was then shared with members of a Facebook group. Okay, so now all of these people, in addition to the network of this person, are seeing this medical record. The same image was also emailed to the same individuals, and the group in question had been named Team No Hose. Okay, that was the name of the Facebook group. So the patient in question had contracted syphilis and was pregnant at the time. Okay, so here we go, sharing this information and the naming and shaming of the patient on social media. Just so you're aware, they did investigate by the hospital as soon as the privacy violation was discovered, and it didn't take long. And the sanction policy was certainly, as you can imagine, the employee lost her job with that. But boy, I mean, how easily can your patients ruin the reputation of the practice by just simply sharing something because they're upset that someone has a certain has something with their body. And at any rate, cases involving the vicarious liability are often filed by coworkers who have had some sort of a sexual harassment in the workplace is kind of what's being seen, or if otherwise just come to harm as a result of actions of somebody else there. But if you're wondering, well, what would happen to me if I had an employee take a picture and send something? So typically an employer can only be found liable for the actions of an employee if that practice can demonstrate that the actions occurred during the course of employment, where the person was doing things completely independently, and certainly you want to have some sort of a policy within HIPAA that says you shouldn't share anything. Okay, so yeah, the hospital could not be held liable in this case because the employee was not acting, quote, within the scope of her employment. So that's really the big takeaway here. So just to go through a couple of more, because it is a growing area of concern for a lot of people. And so a couple of ways that that this is evolved. So Facebook, Twitter, and other social media are finding that that most of the time mobile devices are one of the main reasons for these breaches. So a few examples of how they were caught. So a paramedic posted information on a social media site about a sexual assault victim, and though the person didn't put the victim's name, the paramedic put enough information to where the post was discovered by somebody else within the vicinity of where they lived. And that's one of the big things with social media is it will ways of connecting with people that Facebook might think would find that to be a valuable thing. Okay, and so in this case, the plaintiff filed a lawsuit against the paramedic, and the emergency service was also involved in this due to just some privacy violations. The next, 2 nurses took pictures of an X-ray showing a sex device lodged in a man's rectum with their cell phones, and then one of the nurses posted the pictures on their social media. Certainly, they were fired, but no charges were filed because the nurse did take down the page or the post, and so again, just a simple thing with a phone. There was an emergency medical technician fired after taking photos with his cell phone of a murder victim and posting it on social media. Anything to get a rise, right? So this person had to surrender his EMT license and then perform 200 hours of community service. Fortunately, in this case, the fire station that he worked for didn't face any charges. A few nurses were fired for discussing patients on a social media site. Even though they didn't post any identifying information, they still violated the hospital's HIPAA policy. And a lot of these, again, they have to do with posting pictures, and with social media just right in the palm of our hands, people get curious and they want to be a rock star for a minute. They want to get a lot of attention. We get that. So the do's: create a social media policy, okay, and then make sure to train your staff on the guidelines. When you're using social media, keep your opinions professional. It's often the case that people put humor out there and they'll talk about politics. Okay, just keep the content professional, your opinions professional. It is your reputation after all, and you're always branding that reputation. Communication. Communicate to understand what's going on in your community and also to be understood. Okay, I can't emphasize this enough. Again, with self-promotion, we get that people want to promote themselves, but try to be a leader by trying to understand what's taking place so you can understand how to address some of the issues. And then last do is just to review guidelines regularly. Well, I want to give you some policies that you can write down to ensure your office remains in HIPAA compliance. So again, undoubtedly, social media is a very powerful tool for connecting with people and with patients. But let's develop some boundaries. So as mentioned, assign patient release is required if you do want to post something. Okay, I didn't put that as a do not, but I put kind of a caveat that you've got to make sure you've got some signature saying that it's okay, because that's part of the culture. You want to show people having a good experience. I see orthodontists all the time posting, hey, this person had their braces taken off, and so yeah, people are happy to share their stories, but you just have to make sure they sign a waiver there. Okay, so as far as access controls to your practice's social media pages, make sure you keep the login information limited to the minimum necessary staff members. Okay, so you may have one administrator of a Facebook page, and they're the only person that needs to have that login information. As far as personal pages are concerned, just make sure to limit or prohibit staff from accessing their personal pages while they're at work. Maybe if they're on break, specify that, but make sure that this doesn't get out of hand. And then prohibit your staff from linking personally to a patient's page. Okay, the patient may be a friend of theirs already, and they may be already linked. Certainly, there are connections made before the patient comes in, and we get that in communities. But as far as connecting with the patient afterward, probably not a good idea, because what are you going to talk about other than the procedures and the things that happened? Also, requesting that a signed HIPAA waiver be created. So HIPAA puts the burden of preserving patient privacy squarely on the shoulders of the provider, but an individual patient can always waive those rights. Okay, so having a simple waiver form available for patients, releasing the healthcare provider to share that patient information for marketing purposes, it will satisfy the necessary documentation. And then train all of your staff members of the policies, and make sure to lead your culture in following your policies and your procedures so that people are protected. So you don't have any of these big issues where people are being violated and staff are losing their jobs. So this has been part of a self-audit within the scope of the risk assessment and within social media. I hope this has been helpful. I mentioned now that I'm going to transition into talking a little bit more about compliance as it relates to compliance being done in office, some alternatives, and certainly I want to give you a chance to see a little bit of what we do. So self-audits are one thing that the Office for Civil Rights and HHS.gov are saying need to happen a lot more. And I think you'll find with President Trump and their administration, they're going to be encouraging a lot more of self-audits. So if you're needing a form, if you don't have any of our self-audit forms, I'm happy to send you something that can give you a 360-degree look at how your program's going. But really, as far as a compliance health checkup is concerned, these are some of the variables that need to be considered. On the top, having these policies and procedures. We've talked a lot about social media policies and procedures. Okay, policies and procedures continue to evolve, and we may find with the new presidency that a lot of policies will change and we'll receive a lot of new regulations. Who knows? But start developing your procedures and keep them in a binder, and make sure that you know where that binder is. Make sure it's not collecting dust. And ongoing documentation, you're going to have forms that you implement throughout the year. Audit logs were one thing we talked about. Risk assessments are part of those ongoing documents. And then you've got below, you've got training certificates will go in that binder and fall into that category of ongoing documentation, as well as business associate contracts, as well as risk analysis and risk management action plan. Okay, this is something that's an evolving document. And then you've got security incident and breach management. Okay, and I will just say, as far as breach notification and breach management are concerned, if you would like some guidance, we are happy to help you out there, because a lot of practices we're finding do not have an action plan. Okay, but that's kind of a checkup right there, some things to make sure you have in place. Again, documents that need to be, forms that need to be filled out throughout the year, documents that need to be added to your policies and your procedures. And as far as training is concerned, there's kind of an initial training, and then there should be ongoing training, and we suggest there should be something done each quarter. So this is a compliance health checkup. This is kind of the simplest that I have. And boy, even just going through these things with your staff, if you don't want the more detailed one that I can send you, just doing something like this alone and kind of taking some notes on on how, checking these boxes if you have anything. And then as far as your notes, kind of creating an action plan of what you want to do to move forward could be enough to get you set in motion to have that culture of compliance. So as far as ongoing training and culture maintenance, it's, part of, it really becomes incumbent upon you to ensure you have compliance as part of that, the trust. I mean, when patients come to your practice, they just expect you're going to take care of them, but you're going to take care of their information. Okay, ongoing training on PHI safeguards and some of the things that we addressed today. Make sure that you have an easy reference of the policies and procedures. A lot of times people have just a quick guide or a quick checklist that staff can look over. Make sure you're addressing your staff regularly and surfacing concerns and identifying new variables that perhaps aren't being implemented. And reassessing job functions of things that, well, really, as it relates to PHI, reassessing as people move up in the company or move sideways, whatever the way they're moving. Make sure that you're reassessing the amount of PHI that they need to be a part of. Okay, so in a few minutes, I'm going to introduce how healthcare compliance solutions makes the pieces fit so that you don't have to. And we do that with OSHA, HIPAA, Medicare, employment law /HR. And I really do think that you will be amazed on how we help support your compliance program. And we think that's best done by having a compliance officer. And as mentioned earlier, that compliance officer should not be the doctor if you can if at all possible. So in doing this in-house, again, we recommend doing a security risk analysis. I'm happy to provide a security risk analysis for you, and I'll provide my email address in just a minute. And this helps you to identify things like environmental, IT, some of the human threats, vulnerabilities that could affect PHI. Okay, as far as training is concerned, a lot of people go to seminars to do kind of an initial training. Compliance officers should also be going through their own types of training where they're learning about how to communicate that culture of compliance. They should be identifying the forms that they need to be filling out on a regular basis. There is online training. This happens to be one of the screens from our training. And as far as training is concerned, you don't just have to go to a seminar or do an online training. As far as money is concerned and time, I think that consultants, if you do have a consultant come in, that oftentimes you may find that they take up a little bit more time just trying to figure out your program, a little bit more expensive. But they're fantastic if you want somebody face-to-face. Fantastic resource, and a lot of practices feel very comfortable doing that. If you can make the time to just develop your procedures and develop your compliance program in-house, that is what's best. And that's why one thing we do, we have an online program, and we feel like the best thing we can do is to support the in-house efforts, and really that is kind of our mission, and we feel like that's the only way to create a culture of compliance. The one negative with creating a culture of compliance with consultants is they only come and go, and they may change depending on the price or just depending on where they're at in their career. And so when you consider how you're doing compliance, just take into consideration that this is your program, and you really have to find an option that best fits how you want to grow your practice, how you want to grow your organization and your culture. So the things to expect with healthcare compliance solutions: we have a membership portal. It's a website portal where staff will train. Forms can be customized. Compliance policies, where they need to be customized, can be customized. and you can track your training of your staff members. Compliance binders contain all the information that is customized, all the forms that are customized, and one compliance binder in particular should be what's handed to an auditor should you be audited. And then again, ongoing support, we believe that's kind of our signature sauce with HCSI. We really think that, boy, having an implementation program where somebody can contact you regularly, emailing you, mailing you, and training that compliance officer to know what things should be implemented throughout the year is paramount when it comes to a compliance company. Okay, this has to be something that you develop autonomy for and feel like you can be engaged in, because ultimately you're the one that deals with the patients directly. So as far as training within the online program, we do HIPAA privacy, HIPAA security, OSHA, Medicare, and we also provide a training for employment law. And that could be up at the top in terms of importance. And I say that because I've said many times in this presentation, your employees could very well be your largest liability, your greatest liability. And it's been unfortunate to hear in many cases the many things that disgruntled ex-employee has done to get back at an employer. So that information. I mentioned the manuals. Compliance reference guide is important to be able to flip through some compliance procedures and policies. Compliance plans manual, something that the auditor can see, hey, here's your action plan, here's how things are being documented. And then a certificates binder and a business associate contracts binder as well as something we provide. We provide a consultative phone call that's done every 3 months with an implementation specialist. We provide weekly and monthly updates, a quarterly newsletter, which the image is actually the quarterly newsletter that we would send to you. And you'll notice at the top right, there's a place for somebody that would actually initial and then date that they were present for that particular training. We provide phone and email support, and as I mentioned, kind of a quarterly assessment / quarterly implementation call where each quarter we talk about area within the compliance program that should be implemented and how to implement and communicate that implementation to your staff. So some of the forms that are customizable: the notice of privacy policies, your business associate agreement, all HIPAA privacy forms, HIPAA security, a gap and risk analysis, okay, to determine some of the holes, the HIPAA high-tech breach notification, all OSHA customizable forms, Medicare, employment law, RAC, and posters. Here's what one customer has said about HCSI, quote, "Our HIPAA OSHA compliance was a huge concern in our office, especially after one of our employees filed a complaint with OSHA. We started using HCSI 4 years ago and couldn't be happier with the program. It's simple to set up and easier to use. Do yourself a favor and sign up. It will make your life easier." That really is what most of our customers will say. If you want to talk with our customers, let me know. I'm sure the first thing that will come out of their mouth is, well, it's just such an easy program to use and just extremely affordable. Another testimonial: HCSI kept my fanny out of the who's cow with a cranky patient who thought we had been naughty in multiple ways. Our association with you made all the difference. We passed the inspection with flying colors, and OCR told the patient to bug off. Loved it. So we have a money-back guarantee, and you may think, well, is that all that you offer with your program? Well, here's kind of a breakdown of everything that we do provide. It's over a $3,000 value that we provide annually if you break things up. Where can you find a company that provides compliance officer training? Not just a training that they go through online, but a training that is done over the course of the first year. Show me a company like that that provides the service that can support your program. Employee training, where you can track the progress of the staff. And if you have a new employee, you just simply add their information, provide login information, and they can start right away. A risk analysis. We had someone call a few months ago and said, "Hey, I just purchased a risk analysis for $1,000." And when I found that out, I said, "Hey, we provide that." And $1,000, my goodness. But that is how valuable those risk analyses are in identifying the necessary safeguards that should be implemented in your practice. So I get that. Customized compliance plans. Where can you find a company that will provide customized compliance plans that are also integrated in the training that you watch? Show me that company that has it is integrated and is simple to use. Customizable forms, posters, compliance updates through email and newsletters, and then phone and email support. And that as well at the bottom, I'll also say our implementation program does revolve around all the phone and email support that we provide. So we have a few options. I presented a $3,000 value, but we are providing a promotion. And we'd love to introduce an option where for 5 years, if you want to pay forward and just have this support system there for you, then it's $2,600 is the base, and then $3 per employee. If you determine that you want to just start for just 1 year, we'll give it to you for the first year at $1,189 as a base, and then $3 per staff member that uses the training. Okay. Now, every year after your first year of $1,189, it isn't $1,189 for the second year and the third year and the fourth year. It's $1,189 for the first year, and then it does go to $350 the second year, third year, etc. Now, within 24 hours of watching this, we will give you a $300 discount code. You just have to email lking@hcsiinc.com. Now, why do we do that? Well, we incentivize people that act quickly, because we feel like if you act now, you are going to be more likely to implement these compliance procedures. You're going to begin protecting patients, and that's what we want. We want you to begin protecting your practice from liability, but certainly protecting your patients from any damages that can take place. Couple of things that I'll mention again that are unique to HCSI. The first is how we support the compliance officer, how we train them. Okay, we have information online, but also we provide regular training through email, newsletters, and a quarterly call where we assess how things are going. We identify certain changes that have taken place, how to begin implementing those. And so we think our compliance officer service is absolutely one of the most valuable things that we provide. Now, I've been in offices where their compliance policies and procedures are just kind of scattered. They're in binders with dust in them. And so if that is the case for you, if this kind of looks like your policies and procedures, well, we will have them all uniform and organized. If you ever need to update them when you go through and review your compliance plans from year to year, we have a very simple process that does that for you. And I think you'll be amazed on how that works. Again, our quarterly assessment support calls, we are ready to begin supporting your compliance program and really do see yourself as a compliance business partner for you. And that relationship is something that with many of our customers, we've had that relationship 5, 6, 7, 8 years and more. And so we would be honored to serve you. Well, thanks so much. My name is Lance King. I'm the Vice President of Sales. There's our company phone number. There's my email address. Once more, for those of you that will be taking advantage of our discount, again, within 24 hours of this presentation, this is the 21st of April. This has been a presentation on HIPAA protections, specifically within the social media area of your security risk analysis. I appreciate you making time with us, and I hope you make it the very best day, and let us know what we can do to further serve you in the future. Make it a great day, and we'll connect with you soon. Thanks.